The promise of a COVID vaccine brings us a little closer to that normal life that we've been dreaming of for about a year now. But what's in it? Is it safe? Should everyone get it?
And perhaps your biggest question of all, when will you finally get the notice that it's your turn? Then at your side's Lex Gray spent weeks looking into how this vaccine rollout is going in Hampton Roads, and she found it's really hard to get a clear picture on that.
Yes, that's right. We know that more vaccine is coming, but when it gets here, are health departments ready to get it quickly into the community? Here's what I found out about what will happen in the coming weeks and months. Public health experts have long known someday a pandemic would come.
It wasn't a matter of if it's going to happen, it's a matter of when it's going to happen.
So they've been preparing. Previous flu seasons were like drills leading up to the real thing, which we know today is the coronavirus pandemic.
Unfortunately, the dynamics of vaccinating for COVID is a little bit different than what we were practicing.
Paul Brumman is in charge of operations for Norfolk and Virginia Beach's health departments. He says the COVID vaccine's unique challenges include multiple doses, keeping it in cold storage, and drawing doses from a vial instead of using a preloaded syringe. Still, officials across Hampton Roads Health Department say vaccines are not sitting on shelves or going to waste.
We're ready to move quickly, and we're ready to get this thing done and over with as quickly as possible.
That's Western Tidewater's emergency planner, Will Drury. He says his department has distributed nearly 5,000 doses, actually more than what the state gave them, since healthcare partners chipped in additional doses. But it's those partnerships that make it tough to track exactly how fast vaccine is getting out into the public once it's allocated.
The health department may receive vaccine, and then we share that with other providers so we can help distribute access through the city. So you have to be careful to say the meds are just one component of that system of distribution.
The Central Department of Health says as soon as tomorrow, a dashboard will launch to show the public how quickly providers and departments are moving their vaccine supply. In the meantime, there is no publicly available data to directly compare vaccines in versus out by health district. Still, officials say when more vaccine comes, they are ready to distribute.
A lot of the vaccine plans that we have developed are based on what we saw during testing. We're ready to move at a pretty good clip.
In Western Tidewater, Drury says with a week and a half notice, he can activate a plan to vaccinate 15,000 people in 3 days. For Norfolk and Virginia Beach, Brumman wouldn't give specifics about the department's capacities or goals.
I think in Norfolk we can get to a point where we could do 5,000 doses a day within one facility. And then in Virginia Beach, it could get higher than that.
Brumman says he's vague because resources may shift from mass clinics to smaller neighborhood distribution in order to reach vulnerable people.
Depending on your resources, you have to flex in order to satisfy that demand. So I'm sorry I can't give you an absolute number. It's not that exact of a science.
I pushed repeatedly for specific numbers and logistics, but like Brumman, no other health department official would go into specifics about their plans for the rest of Phase 1B and beyond. Now keep in mind, 1B is an enormous category that will likely take months to get through. As you wait, you can help move the process along by volunteering. We've got the information to sign up on WAVY.com. I'm Lex Gray, 10 on your side.